Every year, May 19th is observed across the globe as World Inflammatory Bowel Disease Day. So let's discuss and know more about this condition in our today's episode. Hi, this is Dr. Lakshmi and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. Joining our discussion today is Dr. Kiran Peddi, Consultant Medical Gastroenterologist and IBD Specialist from Yashoda Hospitals, Somajiguda. Welcome to the program, Doctor.
Thank you.
So India is currently in an acceleration phase with more number of people detected with IBD. So to begin with, could you break us this terminology for us?
You're right, Dr. Lakshmi. So basically, the incidence of inflammatory bowel disease is increasing across the world. But in particular in India, the cases are, more and more patients are getting diagnosed with inflammatory bowel disease. For example, 20 years ago, we used to think that inflammatory bowel disease doesn't exist in India. But nowadays, India, in fact, we are posting almost the second highest number of IBD cases compared to other countries. US being the topmost country with highest number of IBD cases, and India is nearly reaching US numbers.
So what could be some potential risk factors or causative agents which are leading to these alarming numbers, doctor?
First, let's look at what exactly inflammatory bowel disease is. So inflammatory bowel disease constitutes mainly two diseases. One is ulcerative colitis, second is Crohn's disease. And Telugulo dinni manam peyupoote jabbu ani antam anamata. So ulcerative colitis, Crohn's together, inflammatory bowel disease ani antam. So ee madhya kalamlo we are seeing lot of numbers ani cheppukunnamu. ఇవి ఎందువల్ల ఎక్కువ వస్తున్నాయి చూసినట్టయితే వైడ్ వెరైటీ ఆఫ్ రీజన్స్ ఉన్నాయి చెప్పుకోవచ్చు. ఒకటి ఏంటంటే చేంజ్ ఇన్ లైఫ్ స్టైల్. ఇఫ్ యూ లుక్ ఎట్ వాట్ ఎగ్జాక్ట్లీ కాజ్ ఇన్ఫ్లమేటరీ బౌల్ డిసీజ్, ఇట్స్ యాక్చువల్లీ ద ఇన్అప్రోప్రియేట్ ఇమ్యూనిటీ అగెన్స్ట్ అవర్ ఓన్ బ్యాక్టీరియా. అంటే మన ఇంటెస్టైన్లో ఉన్న బ్యాక్టీరియాకి ఈదర్ ఎక్సెస్ ఇమ్యూనిటీ కానీ ఆర్ లోవర్ ఇమ్యూనిటీ కానీ ఉన్నట్టయితే పీపుల్ కెన్ గెట్ చేంజెస్ విచ్ కెన్ లీడ్ టు ఇన్ఫ్లమేటరీ బౌల్ డిసీజ్. సో దెర్ ఆర్ 3 or 4 components in it. One is exposome అంటాం. Exposome is what our human body is exposed to outside insults like infections or dietary habits and lifestyle changes and all these things. So that exposome will have influence on our genomes, the genome and microbiome. So our intestines are full with a lot of microbacteria. In fact, mana human body తీసుకున్నట్టయితే about 3 trillion bacteria ఉన్నాయని చెప్పవచ్చు మన బాడీలో. సో ఈ బ్యాక్టీరియాకి హోస్ట్ ఇంటరాక్షన్ అనేది చాలా కాంప్లెక్స్ సబ్జెక్ట్ అనమాట. సో ఎవరికైతే ఈ ఇన్ఫ్లమేటరీ బౌల్ డిసీజ్కి జెనెటిక్ రిస్క్ ఉంటుందో వాళ్ళు ఒక అప్రోప్రియేట్ ఎక్స్పోజోమ్కి ఎక్స్పోజ్ అయినప్పుడు దట్ ఇన్ఫ్లుయెన్స్ ద బ్యాక్టీరియా అండ్ దేర్ బై లీడింగ్ టు ఇన్ఫ్లమేటరీ బౌల్ డిసీజ్. సో దర్ ఆర్ 3 factors involved. One is exposome, second is genome, the third is our own microbiome. So all these put together will put somebody at a risk of developing inflammatory bowel disease.
So like any other medical condition, consulting the doctor at an early stage is the right thing to do. So what are some alarming signs or symptoms that we all should be aware of, doctor?
So if anybody is suffering to have either unexplained diarrhea, unexplained bloody diarrhea, or unexplained abdominal pain, weight loss, especially in children, they fail to grow, they fail to gain weight, they fail to grow tall in height. So if these symptoms are there, one should be suspecting inflammatory bowel disease, and these patients would require investigation to confirm or rule out inflammatory bowel disease.
So I'm sure diagnosing inflammatory bowel disease can be complex. So what are some typical tests that are usually run to diagnose this condition, doctor?
So whenever a patient comes to us, clinically we normally suspect inflammatory bowel disease and we subject them to basic investigations such as blood tests. Then we go on to do a colonoscopy, mainly look at the large intestine. So colonoscopy చేసినప్పుడు intestinal ulcers ఉన్నట్టయితే we take biopsies and confirm inflammatory bowel disease. So whereas other conditions like Crohn's disease can affect only small intestine sometime. So these patients may require some other advanced investigation such as a CT scan or MRI scan. So దాంట్లో ఉన్న suspicion ఉన్నట్టయితే we sometimes go on to do a procedure called enteroscopy where we enter the small intestine, take the biopsies from ulcers. So once the biopsies are subjected to examination, with the clinical picture, blood test, we come to a diagnosis that yes, we are dealing with inflammatory bowel disease.
So once a patient is diagnosed with IBD, doctor, what are the latest treatment modalities which are available for the patient?
So once we diagnose inflammatory bowel disease, our counseling starts. It's very important to get good understanding of the disease. So at our team at Yashoda, we normally explain the patient all about their inflammatory bowel disease condition, and they usually be advised on lifestyle modifications. And sometimes we start with vaccinations, which are very, very important in preventing infections in inflammatory bowel disease. Because people with inflammatory bowel disease, immunity will be slightly different. Once we start them on medication, the immunity can fluctuate. So prevent any infections happening because of this, we normally vaccinate these people. So once it is done, the actual treatment of inflammatory bowel disease can start. It can start with simple compounds like 5-ASA compounds, and these are the basic medication. If somebody is not responding, then we escalate to immunomodulators and then to biologics. Some people, probably I would say less than 1 in 500 or less than 1 in 1000, patient may require a surgery. The good thing about the treatment option for inflammatory bowel disease, nowadays, especially in the last 2 to 3 years, we are seeing a lot of new medication coming into the market. A lot of new trials have been coming into the market, and after completing trials, the medication will be available into the market. So, a lot of options are available for patients, but the key thing is not to neglect symptoms, get early evaluation so that the treatment can be started sooner.
So I'm sure early detection is the key. So beyond medical treatment, are there any lifestyle modifications that you would recommend for this condition, doctor?
Well, that's a very good question, Dr. Lakshmi. So, a lot of research is being done into the aspects of dietary habits of inflammatory bowel disease patients. Now we say that all the food can be classified into 4 categories by means of the processed foods or unprocessed foods. So highest processed foods are called ultra processed food, next is processed foods, and the other 2 are not processed foods. So the conclusion in short is somebody who is consuming very high ultra processed foods, for example stored food or fast food like burgers, pizzas, and a lot of food additives, high sugar, high fat content, all these factors are supposed to have a risk factor for inflammatory bowel disease. So the dietary advice should start from cutting down all these aspects, cutting down to the modernized food, and we go for traditional food, more of fruits, vegetables, and less of processed, less of ultra processed foods. So once we address that issue, then the actual treatment can start.
So despite the growing numbers of IBD in India, the awareness about this condition is still scant. So are there any common misconceptions about this condition that you would like to clarify?
Well, a lot of myths around that, Dr. Lakshmi. So the common myths are, people say that once you're diagnosed with inflammatory bowel disease, that's end of life, that's end of quality of life and all. Yes, we understand it's a very important disease, but nowadays with advent of a lot of new medication, new lifestyle measures, many patients can lead a near normal life, provided they start the treatment early, provided they take their medication very regularly, and be with the follow-up, with a regular follow-up with the doctor. Then most of the patients can have a normal, near normal lifestyle with that. The other myth is, once you are diagnosed with IBD, I'm not fit for marriage, I'm not fit for family life and all. But again, once the disease is under control, IBD patient can lead a completely normal family life. They can have children, and then they have to take a lot of precautions and early measures whenever the complications of flare-up happens. But with all the precautions, they can lead a near normal family life. The third myth is, all the powerful medication will lead me to complications. That is not true. In fact, it's the other way around. If you're not starting on treatment in right time and not starting appropriate treatment, for example, if the disease is severe, if we start lower medication, it is of no use. If the disease is severe, we need to start powerful medication, and by doing that, we can calm down the disease and all the complications can be prevented. All the side effects of the disease can be prevented. So treatment choice and treatment start date is extremely important.
I think that's well said. So before we wrap this episode, doctor, what message you would like to convey to our audience, especially on World Inflammatory Bowel Disease Day?
The World IBD Day is May 19th. So at this moment, it's very important for us to pass on an appropriate message. My take-home message is, anybody with suspected to have IBD symptoms, please consult a specialist close by. Be prepared to go for any investigation to confirm the diagnosis, and don't hesitate to go for treatment ASAP. Lot of the times we go around many doctors and then that delays the treatment. So when you select your IBD specialist or appropriate specialist close to you, please stick on to the appropriate treatment, take a second opinion if required, and take all the precautions including lifestyle measures, go for vaccinations, and whatever the medication required, whether it's a simple medication or higher medications such as biologics, please do not hesitate because most of the medications are safe and they're very effective if started early.
So thank you, doctor, for being with us, and it was wonderful having you here on the episode today.
Thank you very much.
So this brings us to the end of this episode. We hope you found this discussion more informative and enlightening, and do join us for next week as well. Until then, take care and stay healthy. Thank you.